Let me ask you, in these bioidentical capsules that you're talking, capsules that you're talking about, if your body is producing too much estrogen, wouldn't then taking the capsule give you even more estrogen? How would that really truly be bioidentical? Wouldn't it cause more problems?
That's why we need to make sure that you're in the postmenopausal time period where the estrogen is low, the progesterone is low, and the FSH and LH are high. That's when we might give the estrogen in the capsule. And again, that could be for the vaginal dryness as well as the hot flashes that occur after menopause. Now again, the estrogen is low, but other hormones being high, including FSH and LH, can cause the hot flashes.
Now let me emphasize, these kind of medications are really not medically necessary. Menopause is a normal part of life.
Right.
It's a normal, your body is going through a normal physiological process.
True.
And it's only treated, I take it, if women are extraordinarily uncomfortable. Is that true?
Right.
Because you wouldn't necessarily define this as something that needs medical treatment.
Right. That's true. And in the past we were giving the hormones for heart and bone, but we're no longer considering those legitimate reasons to give.
And let's talk about that, because the reason that hormone replacement therapy has been in the news is because suddenly it's very controversial. Some of the reasons it was given for: heart health, to prevent dementia. Some of the studies have shown that it actually contributes to those problems. Am I representing those studies correctly? Is that right?
I am not clear about the studies on dementia and how those interact with the hormones. So I'm needing to do more thinking about that.
Okay, let's talk about heart health.
Okay.
Because that one is, I think, is fairly clear. Because we thought that taking hormone replacement therapy protected our heart. But actually it turns out that the women on hormone replacement therapy were actually having more serious heart problems than women not. Is that right?
Right.
So we realize it doesn't protect heart health.
Well, we didn't see the protective effect we were expecting. And yet, when you look at the study clearly, it shows that the women in the first 10 years after menopause get some benefit, it appears, with regard to their heart. There are less heart attacks in the group that are taking it in the first 10 years after menopause.
Let's talk about bone health, because that's a symptom that we haven't talked about yet. That is really worrying, I think, to any woman who, as a woman ages. Why do your bones become, I don't even know what term you would use, they become weaker as you age, and it is related to hormones.
Right.
How does that happen? Explain why that happens. How are hormones related to bone health?
They are involved, and again, the mechanism is fairly complicated, but suffice it to say that without those hormones, the bone density goes down. And at that time, if a woman is more sedentary, particularly thinner white women are more at risk for osteoporosis, particularly women who don't exercise. And so, yes, when you stop having periods, you should get your bone density checked, and you should talk over with your doctor where you are and what you need to do to protect your bones.
How is bone density checked?
There is a bone scan, a DEXA bone density scan.
Is it like an X-ray?
Yes.
So they're actually looking. They're actually
measuring.
It's painless.
It's painless.
And they're actually looking at the density of your bones and measuring.
Right.
We should. Both of us are very interested in breastfeeding. We should, at this point, put in a plug for breastfeeding and how breastfeed. So you can really protect bone health long before you are menopausal.
Right.
Explain the connection a little bit during your reproductive years, if you have children, how you can protect bone health through breastfeeding.
Yes. The breastfeeding woman absorbs and utilizes calcium in a much more efficient way, and then her body is better at doing that for the rest of her life.
And I should mention that the studies show that women who breastfeed each of their children for more than 2 years, we're talking about extended breastfeeding here, protect their bone health enormously.
Yes.
So it really is, there are a lot of reasons for extended breastfeeding, but even you're protecting your own health. When you breastfeed, your bones do decalcify to some extent, but once you're done lactating, they recalcify so they're even stronger than before you were breastfeeding. So breastfeeding is also related to bone health. Let's talk a little bit more then about if this DEXA scan that you mentioned shows that your bones are weak, what then is recommended for women to do?
I really like the work of Dr. Miriam Nelson, she's a PhD who did a study on bone density in women who aren't taking hormone replacement therapy. She put them on a regimen of supplements and exercise, resistance training exercise.
And let's talk about, because there is a specific type of exercise, not just any exercise, but it's weight bearing. When you talk about resistance exercise, weight bearing or weight lifting, in some way that you're actually pushing against something.
Right. Push-ups are great for women who are in perimenopause and menopause. Yeah, and walking exercise, running exercise, doing some exercises that put some stress on your back, such as lifting weights like this. It can even be cans of corn, which are, hefting. Anything to have the muscles pull on the bones, which then in turn builds the bone.
So, and this can be quite serious. This is one of the most serious symptoms of menopause, because if your bones become too weak, you can suffer from fractures, and probably most seriously hip fracture. So this is something that women really need to pay attention to and talk to their doctor. Let's talk about vaginal dryness a little bit, because that's another menopausal symptom that we haven't mentioned. And why is that something that is very uncomfortable to women? Why don't you explain that a little bit?
The estrogen really makes the tissues of the vaginal area less dry. It helps with lubrication, and when the estrogen begins to fall off, we have situations where it becomes uncomfortable to have intercourse. It can lead to more urinary tract infections and more vaginal infections, because the body just is not producing as much lubrication. The estrogen that we would use when these symptoms are severe is estriol. It's one of the types of estrogen that has the least bad effects or bad side effects in terms of breast health and causing clotting, et cetera, in the body. And we would put that on topically in the vaginal area. And typically that reverses the symptoms. It's well absorbed and the tissues return.
So this is a cream that you're describing?
Yes.
That you actually put on in the vaginal area. And it's absorbed through your skin. And this is estrogen that you're talking about. But I've also heard of progesterone cream. How do you choose then to decide if you're going to use a progesterone cream or an estrogen cream?
Progesterone cream actually can be used, but the body will change the progesterone into estrogen, because there's a pathway hormones that progesterone is somewhere up here, and estrogen can be made from the progesterone. So it's really the estrogen that seems to have the effect.
What about libido? That's another symptom we haven't talked about, women's sexual desire. A lot of women say that they just, because of the hormone irregularity, they just cease being interested in sex. And for some women that's not worrisome. Again, for other women it is. And how is that treated, and how, when patients come to you and discuss that, how do you help them think that through? The change in the ovaries means that less of the testosterone is produced, which is involved in sexual desire. Less estrogen also means less sexual desire. DHEA is one of the compounds in this cascade of hormones, and it also is involved in sexual desire. Those are all lower eventually in perimenopause and menopause, and that's why, part of the reason why we become less interested in sex. DHEA, being a precursor molecule, is one of the treatments for that. Also, testosterone can be added to this capsule we're talking about with estrogen and progesterone. DHEA can also be added to that capsule. So there's a whole art to putting the hormone mix together. There is an over-the-counter level of DHEA that can be purchased. 25 milligrams a day basically is the dosage. So that would be one thing that could be tried. Exercise increases it.
going out on regular dates with your husband or partner, which you may have let drop by the wayside. This increases all those feel-good hormones that still are there in some quantity. And just adjusting your life so you have more downtime, more relaxation, so you're not feeling stressed all the time.
This has been really interesting, Penny. We really covered a lot in a half an hour. I want to thank our guest, Dr. Penny Shelton, for joining us today to talk about menopause. For upcoming episodes, viewer feedback, and important links, log on to our website at the address that appears on your screen. Thanks for joining us on Health Vision, a production of WOUB Public Television.